Okay. Good afternoon, everybody, and welcome back to the Class of 62 auditorium for the Department of Psychiatry Grand Rounds. Feels like it's been a minute since we've seen each other in this venue, but we are very, very glad to be back, and we're looking forward to a year full of innovative, interesting, creative, thoughtful discussion in this venue of Grand Rounds, whether you're here in the Class of 62 auditorium with us, or if you're connecting with us by Zoom. I see that many of you who ordered lunch have grabbed your lunches. That's terrific. We welcome you to please enjoy that. I would encourage you when you're not eating to consider masking as well, just given that these seats are going to fill up fast, folks. We're going to be jam-packed full of people for live Grand Rounds, hopefully over the course of the year, and we do want to be mindful stewards. A couple of quick housekeeping notes before I introduce today's Grand Round speakers. One is regarding continuing education. So if you are interested in registering for continuing education credits, you do need to complete an evaluation. These yellow evaluation forms can be found up at the cart at the top of the auditorium or down here toward the door. They do need to be completed in order for you to receive your credit. If you choose to complete this, it can also be done via SurveyMonkey. And so for those of you who are attending by Zoom, you'll receive a link to the SurveyMonkey evaluation as well, which will be the vehicle for you to not only get your credit, but also to give us feedback over the course of the year about the Grand Round speakers and sessions that we have. So thank you in advance for sharing your feedback and for helping us to make Grand Rounds better and better as we go along. Without further ado, I would like to welcome our chair, Dr. Ben Lee, to the podium. He'll be sharing with us today a little bit about the last 5 years as a retrospective and the next 5 years for the session that he's entitled From More to Meliora. Welcome, Dr. Lee. Thank you. One other quick note before we get started. For those of you who are on Zoom, you are welcome to please enter any comments or questions into the Q&A box, and I'll be moderating that Q&A session as a combo between the Zoom Q&A and the live Q&A. We're going to see how that goes, but I'm going to try it at the end of our session today. Thank you, Dr. Lee.
Thank you. For those who are joining from by Zoom, it's hard to believe how much equipment I'm surrounded by in order to do this hybrid. Can you hear me okay? Good, good, good. All right. So I'm Ben Lee, and I was going to talk about last 5 years and about the next 5 years. As you know, every academic year starts by having me give a sort of like a state of a department talk. And so I'll do some of that as well. I have nothing to disclose. Meanwhile, I want to begin by just expressing my gratitude for everybody who was involved and participated in the 26th World Congress of ICPM over the last week and the 75th anniversary soiree that was very successful. We had more than 300 people participating in the ICPM, and the 75th anniversary also we had more than 600 people participate. It was probably the largest departmental event we've ever had, and I think I probably need a vacation after all this. As we saw, we had 250 registrants from all over the world: Hungary, Iceland, Japan, Korea, Italy, Germany, and everybody really complimented on the hospitality that our staff and organizers displayed, as well as wonderful content and how smooth the overall operation was at the ICPM. It really, I guess reclaim is too much of a strong word, but it really cemented our department as the birthplace of biopsychosocial model by having this meeting. At the same time, it allowed us to develop new relationships and new collaborations. We're working on a couple of MOUs and also partnering with some of the departments where, and that was followed by the award ceremony. During that ICPM meeting, we had the award ceremony, during which Senator Samra Brook came and did a New York State Senate proclamation that honors the Department of Psychiatry at the University of Rochester Medical Center for the 75 years of service to the Rochester community. And that proclamation is now about to be added to our hallway decoration. And that was also a very joyous event. And then we had that 600 people event that happened at the Science Museum on the evening of Friday. And that was quite an event that we celebrated the 75th anniversary of the department, and then followed by the alumni breakfast and tour that happened on the Saturday. All of these events were not possible without the assistance of our organizing leaders, George Nazra, the ICPM, the meeting president, Ellen Polshek, the ICPM program chair, along with Stephanie Bruder, who worked as an executive director to really ensure the overall smooth operation, and the members of steering committee, program committee, and poster committee. And then, of course, all the people who were involved in the 75th anniversary soiree led by Zina Schubert, who led the 75th anniversary planning committee. There were a lot of volunteers involved, a lot of staff involved for both events, and of course, all the people who attended during their busy schedule to make this celebration really worthwhile for everybody. So I want to thank everybody. Now, goals today will be first of all, I wanted to discuss as I just finished my 5-year term, first 5-year term as the chair of psychiatry, we did a 5-year review of our department, and I wanted to share some of the results as well in relation to state of department that I was going to talk about. And then we wanted to talk about the next 5-year strategies, particularly starting with the SWOT analysis that we did. And the list, I would like to list some of the goals and strategy for the next 5 years, particularly from the chair's perspective, because the finalized version of the strategies are right now being worked on. It's almost done. Now we are right now in the phase of putting the timelines in relation to the strategies. And then the basically message is that we want to focus more on the quality more than the quantity. We want to focus more on getting better rather than more. In other words, more to Meliora. We also want to focus more on the integration than growth, particularly smart growth, and focus more on retention than in recruitment, with a focus on wellness. And I touched a little bit about how we want to focus more about application of biopsychosocial model overall, because time has passed. We no longer have to convince the world that biopsychosocial model is important. And I talked a little bit about that as well. It was about 5 years ago when my family moved from New Haven, Connecticut to here. And that's a picture of my family about 5 years ago. My kids were, I guess, smaller and younger, and I was younger as well. And little did I know what I will be faced with, the challenges ahead. And I was a division chief at Yale, and it took me about at least 2 years to just understand the overall scope and the structure of the department and how large our responsibility is regionally, and how large the department is and could be, as well as how we had to really rebuild our structure of the department if you are to meet the challenges that were ahead of us. because we had overwhelming mental health needs in the community. And then, of course, COVID-19 hit, and then the overwhelming needs became very overwhelming needs in our departments. And it also changed our lives. And then there were also a lot of social upheavals, including racial reckoning that was overdue in relation to over the nation's George Floyd incidents, about the murder of George Floyd. And of course, there was a Daniel Prude incident that we had to deal, we had to process locally as well. All those things led me to really, my first 2 years were really focused on just developing a framework for the department in relation to success. But overall, we have been focused primarily in becoming larger and bigger and more productive in meeting the needs of our mental health in our community. And also we focused a lot on trying to build a community with values. We talked about how we are an advocacy department. We talked about diversity and inclusion being department's foremost priorities. And out of those ideas, we began with the developing 5-division structure with clinical and research chiefs to integrate the missions and disciplines. And also we worked hard on developing a unified administrative structure that would allow us to be more dynamic and more responsive to the challenges. And also we wanted to have a very increasingly more transparent in all aspects of our department, particularly in the promotion process. And furthermore, we began my first grand round topic when I became the chair. I think it was September, first week of September, was actually, the topic was about diversity. It was about my prior work in doing community-based partnership research among Asian American elders, and how we wanna continue to develop that line of work within our department in different population and continue to advocate for those who are marginalized and vulnerable. And we also began the journey of really focusing on our department as being a community of advocates with 4 C's plus 1, there is 5 C's, and emphasizing the value of communication, collaboration, complementarity, competence, and compassion. This is the departmental structure as it is, as you are by now, hopefully very much aware of and have embraced. And it has gone through, of course, some changes. And it will actually add 2 more divisions in the next couple of years. We have already added the Division of Medicine in Psychiatry, led by Telva Oliveras and Marcia Witting, which becomes very important for our vision, as well as we will be adding Addiction Psychiatry Division over the next few years as well. We also developed a matrix-based discipline leadership across many disciplines that we have. We have intentionally started to appoint nursing chief, social work chief, physician chief, psychology chief, psych nurse practitioner chief, KSAC, LMHC, family therapy, and we probably will continue to develop more discipline chiefs as the department becomes increasingly larger and more diversified. We are a multidisciplinary department that really wants to leverage our teamwork and diverse background in relation to delivering the kind of care that we want to provide, as George Engel talked about. We also worked really hard to develop more robust administrative staff. Now, Carafali Toombs will be retiring in sometime in October, and right now their search and her presence will be sorely missed. But under her now we have additional layers of administrative 2s and 3s clinically, as well as we now have more robust support, which should get larger and larger, because one of the challenges are, as our department grew so quickly, the administrative growth has been, we've been growing, but not as fast as our overall department growth. And led by Natalie May Dixon in our research leadership, as well as Mary Gramlich in the education leadership, we've been also growing that administrative support as well. Just is showing the diagram for our overall faculty promotion process that we meet on a monthly basis, and as transparent as possible in terms of what is valued in our overall academic process, as well as demonstrating how we want to continue to strive for these processes. All these changes have really fueled the overall unprecedented growth of our department in the last 5 years. We've recruited 68 faculty members, and that pretty much shows overall how we have recruited in the last 5 years. And that made us now 151 faculty member department, which is one of the larger departments now in the country. And recruitment over each of the divisions are impressive, particularly in the area of child psychiatry, as well as in the community psychiatry, as now we are about to divide the community psychiatry into 3 separate divisions by separating out MIPS and medicine and psychiatry, that is, as well as addiction psychiatry. And then the collaborative care and wellness is another department, another division that is becoming rapidly developing as well. And other divisions such as geriatrics, as well as acute and adult psychiatry divisions will follow the suit as well. Overall, as we continue to expand and recruit, we have had 60% increase in our total outpatient encounter volume. We now handle about 400,000 encounters per year, which is impressive. And that doesn't include our 10-bed summit unit of medicine and psychiatry expansion. And we most likely we are planning to include, expand our another additional 12 inpatient psychiatric beds and etc. Education also has had tremendous development over the past 5 years. The training of our medical students, residency and fellowship, and psychology training, family therapy training, nurse practitioners, nurses, and social work, all of them have been continuing to really set the standards, as well as the innovation that has been happening in our department has been very impressive. Behavioral skills lab has led a simulated patients program that likely should be expanded further. Idea Core is another program that we have started that has helped out with many of the education projects. We had 4 Dean's Teaching Fellowship in 5 years, Coaching Academy. Now we have psychologist coach in 13 departments that are helping out with residency and infusing a biopsychosocial model and teaching to each of these large residency programs around the department, so that we can preserve our tradition of biopsychosocial model, not only in our department, but overall for the medical center as well. And we now have a new fellowship program in consultation liaison psychiatry and addiction psychiatry, as well as expanded psychology training programs as well. The research growth also has been impressive, as we have now hit last year $21 million in terms of overall grants and contracts. And this year already, we are already poised to hit 25 million, as some of the newer results from recent NIH review has come along, and there are excellent news. I just heard that Will Pigeon just also received $6 million grant from Department of Defense in relation to really studying treatment of insomnia in TBI patients. And that type of news is gradually improving our overall research portfolio. It's also a diversified portfolio as well. Our Department of Psychiatry also has been gradually gaining in terms of a stature and ranking in NIH. We are about, I would say, about top 30 program in terms of NIH ranking. And we'll probably climb up that ranking even further this year after we confirm some of these great news that we've been hearing. Because the number of submissions that's being handled by our research administrator has been also gradually increasing, rapidly increasing is more like it, as well as the recent news that we have heard from Peter Wyman's group, as well as excellent news that we have heard about recent reviews from Kim Van Orden, Ariel Schefter. Paul Geha actually heard two great news about 2 R1 studies that he has submitted on chronic pain. Tony Pisani also has heard excellent news about another R34 group. So our research groups are also doing very well. And of course, there is a research recovery center of excellence funded by HRSA that had another additional year of funding that has now become almost $16 million project. Financially speaking, our department also remains very strong. We are one of the few psychiatry departments in the country that is able to maintain a contribution margin. We are projecting about 7 million contribution margin this year, but there is some trend that we are beginning to focus on. Our outpatient margin is gradually reduced. And that's something that I will talk about. But overall, as we add the grants, endowments, and advancement, and etc., we are now, our annual revenue is now about $120 million a year. We are a big department that has a lot of activities in all across our overall departments. But what I'm actually most proud of our department is that our overall organizational framework and overall structure has withstood the challenges of our life, our society. We were able to deal with COVID-19 and its aftermath through medical integration of psychiatric services, being able to respond to all these issues related to infection controls, and also rapid conversion to telepsychiatry led by Michael Hasselberg, and our ambulatory care team has been really envy of all other departments around the country. And also, by being able to develop our programs rapidly, that, believe it or not, we've been spared of some of the even worse crises that many other communities has faced. Our mobile crisis services expansion, CPAP enhancement, crisis call lines, and a variety of institutional collaborations has led us to be more dynamic in meeting these needs. And we have expanded tremendously as we hit the 400,000 encounter mark in building a new expansions centers, a child center in Science Park, as well as a consolidation of a geriatric mental center in Science Park as well. And of course, the adults program in our Chestnut Street as well. And if we hadn't focused on our DEI agenda from the very get-go of our 5-year plan, I don't want to even think about how we were able to manage and how we were able to respond to many of these social changes that we have experienced and had to deal with, and also be able to position ourselves to be able to do better and do further in relation to racial reckoning that has been overdue. Today, our department is a 2-campus, three ambulatory care center department. 2 campus being Rivas campus and the Brighton Health campus. More than half the revenue these days actually is generated by Brighton Health campus. If you if you exclude the inpatient unit. And now we have ambulatory care site in Chestnut in downtown, and as well as Golisano Pediatric Behavioral Health and Wellness Center and the Geriatric Mental Health Center in Science Park ways. And we have several embedded services in pediatric behavioral health in 100 River Road, Women's Health Center, as well as there are many programs through the collaborative care and wellness service. And yesterday I did a walkthrough for 179 Surly Trails, our new EAP, BHP, UMHP space. And that's some of the pictures from that new space that we are looking at. Now, it's not the whole building, it's a part of the building, but who knows in the near future that we'll be taking over the whole building at this rate. And there's a concrete plan now is to develop pediatric crisis stabilization program in the ground floor of the R building next year. And then 12-bed expansion of our adult psychiatric inpatient program by 2024. And then the big one that's ahead of us is a 100% expansion of our CPAP to really reduce the logjam that we see in our CPAP by 2027. Our wish list also includes moving our pediatric inpatient beds to the top of the Golisano Children's Hospital by 2028 and 2029. And our 10-year plan do call for moving out of our 75-year-old R building. It is indeed a wish list. But, I don't want to be celebrating 100th anniversary of our department in the same building. Clearly, no one does. And in other words, our 75th anniversary is also a reminder to everybody. That's how old our building is. And we need to keep advocating to really take a look at our overall facilities, because our SWOT analysis also revealed as well. Our strength that you told us were commitment to high quality, the rapid growth that we have experienced despite COVID-19 pandemic, and many opportunities for trainees, an innovative and varied research portfolio that keeps growing by the minute. And also, I was really glad to see our department perceives that our culture of inclusivity and collaboration and geniality and kindness is one of our strengths. And that's something that we need to continue to cultivate. And that relates to our overall strategy as well. There are also the weaknesses that you have told us about. Uncompetitive pay and benefits for staff and all levels of faculty. Challenging and outdated work environment, particularly our building. And the public perception. We have focused a lot on diversity and inclusion within our department. But it is really important for us to now move beyond the boundaries of our department to really strive for mental health equity and diversity and inclusion for our patients as well. And then there is this insufficient capacity to provide care as our wait list and capacity to care, despite all that growth, hasn't kept up with the growth of the needs in our community. and the shallow bench in relation to, as we have recruited younger, early career faculty and staff as quickly as possible, we are beginning to have issues in relation to having mid-level and senior leadership that is able to really foster the developments, as well as needing programs to develop our junior and mid-career faculty and staff. And that relates to our structural growing pain. Especially, we want to also make sure our vision for the department is in line with everybody's career and divisional structures and etc. And that is why since March, we've been going through this strategic planning process that began with this SWOT analysis. There are lots of opportunities ahead of us. Funding streams are now varied. Our society has never appreciated mental health as they do now, or the funding stream has been lagging behind. And the new faculty and the staff and the trainees are increasingly equity-minded and are providing fresh ideas. And then there is a proven model of effective telehealth care that we have demonstrated, and diversity in terms of perspective and background within our department. And there are lots of developmental opportunities for our faculty and staff. But there are clearly threats. And the threats, you can look at it from two different categories. Essentially, it comes with an idea of short staffing related to recruitment. There are major competitors that offer higher clinical salaries and more attractive benefit packages. And we have our own struggle to develop, recruit, and retain high quality staff and trainees. And then there is a recruitment issue. We all have gone through COVID-19, and there is a fatigue and stress that we have experienced, and trauma that we have experienced as well. And that affects our overall wellness, and also our underrepresented minority workforce that has also experienced both acute and systemic racism over the years that we need to really address internally and externally. Department mission is something that I have stressed from the beginning. And this is a slide right out of my first grand round. We want to provide high quality, compassionate behavioral health care in our region, powered by our world-class researchers and teachers and clinicians. Now, vision remains that we want to create a department of permeable boundary across the disciplines, specialties, and our roles. We are adding to that. We want to create a permeable boundaries across race, ethnicity, political beliefs, religious belief, and all along, we want to be a community that welcomes everybody. And our values remain collaboration, communication, complementarity, competence, and compassion. Overall, based on these values, we are working on, about to finalize our strategies and timeline. We want to focus on the patient focus and evidence care. We want to develop strong research programs that integrate to these research clinical programs. And we also want to nurture and maintain an interprofessional learning community, as well as healthy informatics also becomes a tool for our integration, as well as being able to do things easier and better, and also innovate. And also we want to continue to advance an inclusive and equitable department culture and be a preferred workplace. And this is the really important aspect of next 5-year vision in enhancing faculty, staff, and learner wellness, and be able to assist their resilience. And overall, my vision for the next 5 years is moving from more to better. Last 5 years, we focused on expansion and recruitment. We want to focus more on integration and retention. We want to focus rather than quantity. We want to focus more on quality and value. And we want to move from being a community mental health system to more of a learning health system that we can learn from our experience and be able to innovate, and from rapid growth to more of a thoughtful, smart growth. And the key strategy by mission is one is that, as I talked about, we want to have a smart growth that leverages informatics and technology that can reach more patients and beyond the greater Monroe County, and be able to, for the research, we really want to be able to integrate research into our clinical areas that takes advantage and leverages our overall, our vast clinical services. And also in our education, we want to go beyond being the largest pipeline of behavioral health service provider and be able to be a leader in terms of being an innovator through disciplinary training and an innovative model of education. And also community, we want to go beyond again and focus on the application of biopsychosocial model to address social determinants of health. And go beyond having events, being able to reach out to more people. Particularly all of these things, the key strategy for the next 5 years is to really addressing the burnout and improving administrative support, recruitment, retention, and overall support for the department, faculty, staff, and trainees. Overall, we've been doing department wellness survey on the annual basis, and we are the only department that's been doing. And we are now working on onboarding and orientation by having a task force that's now working on those things. And we are developing early mentoring and coaching programs for the faculty who has been just hired and who are progressing along our overall ladder. And also, we're going to start working on the staff and faculty engagement as well by enhancing our Office of Communication and Engagement. And we have a very ambitious plan through the funds that we have received through OMH in relation to actually doing department-wide consultation in relation to how we can engage our staff better and engage our staff better. And our administrative team has to grow in proportion to the clinical growth. And compensation really needs to be looked at. And the faculty support group that has been growing, that also needs to grow even further in many ways. Importantly, for this clinical strategy, we really have to grow in a much more smart that leverages informatics. If you really think about what our department has been doing, despite our rapid growth, right? I mean, the demands has gotten even faster. The opioid epidemic during the time of COVID actually has gotten even worse. Before the pandemic, 65,000 people died during the opioid epidemic in 2020. In 2021, 100,000 people died. Our wait list has definitely not gotten shorter. It seems to be getting longer. And the rapid growth in the clinical staff has been so fast, we have not been able to keep up in terms of administrative support. And that the burnouts and wellness has been also important. And the cost of delivering our psychiatric services also has outpaced our overall revenue. And that's not something that we really need to just sit and watch. Let me show you an example. Over the last 5 years, we've had about 35% increase in overall clinical revenue. Outpatient is increase was even more impressive, 51%. But what has been also impressive and threatening is that our overall operating expense has increased even faster, particularly led by issues related to staff recruitments and faculty recruitments and those kind of things. We have to find a way to balance these growth and overall operating expenses. And the way that we think about is to become more judicious and also be more intentional in terms of how we grow, rather than just keep expanding our services as the opportunities that are real or imagined that arises. Informatics becomes key to this, because without knowing what we are doing, how we are doing carefully, it's difficult to develop strategies and meet the needs of the community. We are going to implement EPIC behavioral health module over the next 2-3 years. We'll have far more robust health informatic teams. And then we will consolidate our department data structure. And we will gradually move to become a learning health system. This is our psychiatry data informatics structure that we will be evolving. Right now, we have a bit of a silo: clinical informatics, clinical data reporting, and research core. This is something that we're going to gradually integrate and be able to enhance over the next 5 years. We are already engaged in many technology-based efforts. We are already one of the largest telepsychiatry providers in the country, as geriatric psychiatry team has led our nursing home support for, I guess it says 60, but it's growing by every 2 weeks. We are adding another 1 or 2 nursing homes at this point. PAO models that supports local emergency departments, telementoring programs related to Project Echo, Project Teach. And there are lots of pilot projects, brain wellness apps, virtual reality therapy, avatar-based companion for loneliness that we are doing pilot research on, virtual reality-based visual remediations in schizophrenia. We are also negotiating and partnering with industry that are interested in working with us in terms of developing CBT apps, wearable data collections. And now we are being approached to develop MOUs with some of these newer programs from other countries as well. Innovation becomes very important. Our idea core is right now on a pause. We'll move it toward more of a education-specific innovation lab. Disciplinary training is the essence of our overall training. It should be the idea of consolidating all the teaching days to Wednesday is something that our Associate Chair of Education, Dr. Sipora Rosenberg, has been really advocating and will be done. And the enhanced recognition for our teachers. And that's something that we are committed to do. And overall, our advancement effort also should be focused on these efforts as well. I think, probably Wendy Cross will be a bit unhappy that I'm showing this. She's right now in sabbatical in relation to really applying this concept of design thinking in relation to innovation in education is something that I'm very excited about. And the idea of integrating research into every clinic. There are great success stories in our department, like AD Care, that we have embedded clinical trials within our memory care program. But outside of that, we don't have a clinical research program that really partners with our clinical services. Although recently I heard about Intercept, a study, Intercept program in our Strong Ties, and that's really encouraging. And soon we have this exciting development in child psychiatry in relation to treating treatment-resistant adolescents with latest treatment method. And our research program also sometimes often don't address needs of our community, although we do have a success story related to source of strength programs that's led by Peter Wyman and his group in relation to working with local high school programs. And you know, these have been important barriers in our overall research growth as well. And we want to continue to develop partnership and team building between researchers and clinicians. And health equity and outreach research is very important. And addiction psychiatry division also will be partnering researchers to be able to do really be position itself to lead the field as well. There are many emerging areas of research. Center for Retina and Brain was launched in the last couple of years, led by our Associate Chair of Research, Steve Silverstein. Network-based intervention research is being led by our leaders of our suicide, CSPS, Suicide Prevention Research Team. And the sleep disorder and pain is the fastest growing area of our department as they are bringing in excellent news related to new funding. And then there is an emerging area of a cardiovascular psychiatry research group that are also happening as well. We also want to be able to expand our Deaf Wellness Center to add a research dimension and truly become multidimensional in our Deaf Wellness Center. We have also recently recruited Eileen Aljur to our faculty. And you know, this is a unique opportunity that we have such a wonderful deaf wellness faculty members who can really set a standard and model for this field across the country. Addiction Center, we have a new medical directors, Recovery Center of Excellence is obviously ongoing, as well as Addiction Psychiatry Fellowship. And, you know, we will be pushing to develop overall strategic planning process at the medical center level. And our DEI agenda, which is central to our overall community missions, we really have to find a way to go beyond, emphasizing the need for DEI in our missions, but be able to truly apply these concepts in what we do in a day-to-day basis, become more data-based and intentional in how we do. And as we recruited our new faculty area, Sheftel, and also Tracy Terrence, who has been also working in the areas of disparity and quality of mental health services, we want to go beyond what we have done. And the New York State is already providing a wonderful opportunity. There is a $13.5 billion pilot that's being now providing potential opportunity for all of us. The 1115 waiver amendment is something that we are very interested in. And it's prime opportunity to advance our value-based program, particularly in relation to all of our works related to medicine and psychiatry division that now is growing and has now full set of services, inpatient, outpatient, and be able to really work together. So in summary, our aspiration over the next 5 years is really focused on internal integration and enhancing our wellness, as well as strengthening our ties with one another. We've gotten so big. There was actually an embarrassing moment that I had during our 75th anniversary. A couple of junior faculty introduced themselves, and I, you know, I couldn't recognize them. They were hired during COVID endemic, and it just have, for my excuse, I guess I didn't have enough contact with them, but it's also a reflection of how we have lost some of our strengths that have really marked our department. Smart growth, integration, and innovation in our training, and really addressing the social determinants of health through our, in our communities, what we need to really think about. And that was why the theme of our ICPM Rochester was the application of biopsychosocial model. We are well past 1977 when George Engel talked about challenged biomedical dogmatism, because he was worried about how healthcare system was more focused on disease than the patients. And at that time, there was also anti-psychiatry movements that was very much focused on sort of marginalizing psychiatry and casted doubt about mental health in general. But we don't have to do that anymore. Biomedical dogmatism is essentially over. We have things like patient-centered care, personalized medicine, value-based care, social determinants health. These are all different ways of spelling out, saying things that George Engel once talked about. The 4 C's of patient-centered care, culture, care, communication, collaboration. Doesn't it sound familiar to our 4 C's? The social determinants of care, the variable that explains 80% of health outcomes. Doesn't it sound like also application of biopsychosocial model? World Health Organization already defines health as physical, mental, and social well-being, not merely the absence of disease or infirmity. The world does not need convincing anymore. What the world and the field needs is somebody to lead them to application of biopsychosocial model. And COVID-19 and vaccine and politics and all this stress has underscored those things. And we need to show the world, how do we practice biopsychosocial model rather than focusing on why do we need to practice it. So overall, I was thinking about the last 5 years, and I was thinking, it was probably the hardest 5 years of my life in many ways. And for many of you, I'm sure it was as well. But at the same time, it was the most rewarding 5 years of my life as I led this department. And I'm very much looking forward to another 5 years. And the last 5 years, we had a period of tremendous growth. But we're going to turn our attention a little bit more differently. We're going to focus on integration more than growth. And we're going to focus more on retention more than recruitment. As we think about smart growth in our clinical care, integration in our research, innovation of our education, and the most important of all, application of biopsychosocial model in our overall services to ensure mental health equity and reduce disparity. So thank you. And my kids have grown up now. So.
Thank you. Remember that, but this was all Pardon me. It's really a beautiful summary of all that our department has shaped, grown, and endured, built despite extraordinary circumstances and under what was then new leadership. But it's also refreshing to be able to look ahead at the next 5 years at all that we have yet to accomplish, with a particular focus on enhancing the wellness and well-being of who we are and what we do as we care for patients, as well as a focus on diversity, equity, and inclusion in this smart growth model. So open it up for some questions for here as well as on Zoom. You've left them speak. That's excellent. Well, again, thank you so much for joining us today. I know folks have 1 o'clock meetings to get to as well, and we'll see you here next week. Thank you again, Dr. Lee.